A very warm good afternoon to one and all present here. Today we're going to talk about a very simple but very effective topic, that is, do not waste time on facility rounds, make safety a daily habit. And this is exactly why safety should not depend on periodic facility rounds, and how we can make it a daily habit for everyone working in a healthcare facility. This session is designed for healthcare leaders, administrators, nurses, doctors, and basically just anyone who's responsible for patient safety and staff safety. What we'll discuss today is practical, realistic, and directly applicable to Indian healthcare settings. As a company established in 2018, we have a community of over 10,000 healthcare professionals, over 75 network hospitals, and over 50 course topics. A quick acknowledgement for all our healthcare professionals who make our community so vibrant, from nurses and doctors to administrators and educators who are joining us today. This space is for you, a place where we can learn, share, and grow as part of a forward thinking healthcare ecosystem. To be part of our growing community, you can follow us on social media, that is YouTube, LinkedIn, Instagram, and Facebook. We are on all of these. And you can also join our WhatsApp and email community for regular updates. We have our WhatsApp QR code at the end of the session. Coming to our learning pyramid, this is for our new comers who are not familiar with this. So our logo is based on 4 different pathways. We've got stage 1, where we're looking at service excellence skills, which is the foundation. And stage 2 is the core patient-centric skills, which strengthens your hands-on competencies and improves your overall patient care and expertise, so you can deliver safer and effective care. And stage 3, we're looking at specialization skills, where you can build deeper expertise through focus programs. And stage 4 is leadership skills, where you will learn how to be a leader. And this webinar series is sponsored by SafeMed Devices. And this is a company which is focusing on delivering dependable medical devices and enhancing patient safety. We thank them for supporting this educational incentive and our shared commitment to safer healthcare environments. In case of any queries, as you all know, you can contact our admin manager, and her number is here. So this is the number you can call for any sort of inquiries. Today's speaker, we have Dr. Parivallavan Rajavelu. Many of you must be aware of him. So he is the Deputy Medical Director and Consultant Surgeon at Sundaram Medical Foundation, and he is also the visionary founder of Skills for Med. So Dr. Pari is a general and laparoscopic surgeon, and he's practicing at Sundaram Medical Foundation, one of Chennai's most respected multi-specialty hospital. He brings deep hands-on experience in clinical leadership, safety, and systems environment improvement. Thank you, Dr. Pari, for being here today.
Thank you, Diana. Thank you for the introduction. Thank you.
Yeah, and we will start with our pre-webinar poll, as we always do. The questions will come up on the screen, and all of you have a chance to answer. And Dr. Pari will take you through the polling results and also go ahead with the session today. So the poll has been launched. I see a lot of people who have started to answer. So this poll is not to evaluate how much you know. It is more for us to understand you as an audience better. And responding to the polling questions will help us to tailor examples and to discuss based on this context. We'll wait for a couple of minutes. I urge all of you to participate in this polling, and we'll finish it in the next 1 minute. So if you can give your answers by then, it will help us to understand you as an audience better. We've got 30 seconds more to go. Please do fill in your answers here. Couple of more seconds. So I'm ending the poll here. Thank you all for your answers. Dr. Pari, you can take it from here.
Thank you, Diana. Good afternoon and welcome back to the Friday webinar. I think after the Christmas and New Year, we had a long holiday and we are back at it again. And thank you for again turning out in such large numbers for this webinar. So let's look at the poll questions first. So how familiar are you? I think this is expected that facility rounds are done quite regularly and we're pretty familiar with it. And of course, few of us have said that they have limited knowledge about that. And you also used a new word called environment of care. I think people who are involved in JCI will know this. But I just want to know, we wanted to bring this term here so that everyone is aware of this term. We will explain more in detail during the course of the webinar. So what's your biggest challenge? Lack of time, unclear about what to look for, and no standardized checklist. I think this is usually the common problems every one of us face. And of course, difficulty in reporting incidents. So many times after the rounds, there's not a system by which we can actually report and take this forward. So that also is a challenge. And that is why many of the facility rounds do not succeed in actually making improvements in the environment. And how often do you personally identify safety hazards in your own work environment? I think this is a very important question from today's webinar point of view. And daily, almost 50% of you, half of you have told, I actively look for issues on a daily basis, and I look at it occasionally every week, and monthly only during formal inspections, and rarely. Okay, so this is as quality professionals and people working in healthcare, something which it's a lens which we should develop. And I'm not talking about physical lens. It's a mental lens that when you work in any environment, you always look for any hazards, anything which can be a safety issue. And have you ever witnessed a patient or staff incident, a safety incident that could have been prevented? Again, 2/3 of you have told multiple times, and once or twice, another almost 90% have told that yes, things happen. In spite of the facility rounds, there are things which are happening on a regular basis. So this is something which is a journey rather than a destination. So that's what we tell. But is there a better way to prevent these things? Is something which we need to think about. And finally, our usual film queries. I think our team should probably change the film reference when the next time. But still, it makes sense that majority of you think of Three Idiots as the title, and another small majority about Tare Zameen Par and Munna MBBS. So basically, we all know how to do facility rounds, and we have had experience of it, but we always have this uncomfortable feeling. Can we do this better? why can't we actually prevent this accident which has happened by doing the facility rounds? So this is what we think about. So basically, this whole webinar we conducted only because of the frustration I had during the quality journey in our hospital, and this is a reflection of that. Can we move to the next slide, please? Yeah. So one of the first questions I wanted to start today is, how many hazards did your facility miss today? You're not talking about you. You're talking about the various departments in your hospital. And many of you have told that, yes, I do look for, hazards every day. And this happens. So, a cable or a wet floor or, a boxes obstructing the fire exit. On the first day, you'll be very sensitive, sensitized about it. Or you think, oh, this should not be there. No, we should do something about it. But the same boxes are there for weeks and months, in the where the fire exit is. Then it becomes normalized. So nobody seems to think that it is a safety issue. So this is the problem with facility rounds. Familiarity of hazards makes us insensitive to these hazards. That's something which happens because we are not able to change things. There are so many factors to change. One is the cost and also the departmental hierarchy, people working in silos. So all these things make it not possible to change these hazards immediately. So we become sort of, desensitized to these things. So Eleanor Everett said, safety is not a gadget, but a state of mind. So can we have this fresh look every day we start our rounds and see these hazards and notice how much we are missing? So that is the question I want to start with in this webinar. So today's agenda is we will talk about what environment of care really means, why periodic facility rounds may not be the prescription to prevent errors, and can we change this to daily safety ownership by all staff? So this is the main crux of this webinar. So can we not, I know we put a very provocative title to this webinar, no, don't waste your time on facility rounds. And that, we just wanted to raise this. And what are they talking about? Why is facility rounds a waste of time? I'm sure you would have thought about it. So here also we are going to look at a framework, because it is very good saying, we should do daily safety awareness. But unless we have a framework, it is very difficult to practice this and very difficult to train others to do the same thing. Many of us have been in this quality journey that slowly we have developed this ability over time. But how do you teach this to a person who's not a quality professional or not looking at safety science? So that is the what we're going to cover today. Next slide, please. Yeah, let's start with the case scenario. So it's Tuesday morning in Ward 3B. And this patient called Lakshmi, she is 68-year-old. She is a post-operative patient. And when she wants to go to the toilet, to the restroom, she tripped over the oxygen tube that was going across the room. So this resulted, she's actually got admitted only for a simple procedure, but now she has developed a hip fracture, led to extended hospital stay, a lot of expenses and suffering, and husband being a lawyer, is now initiating consumer protection case against the hospital. So when the root cause analysis was done, facility rounds was done weeks ago, and that particular corridor was marked clear. So this happens, and we've seen this happening many times. So next slide. Yeah, thank you. So why do the hazards go unnoticed? So sometimes facility rounds happen occasionally, or maybe every week nowadays because of NABH. And we have only a limited number of people who can be safety officers. And the staff see hazards, but either they lack the mechanism or confidence to report them. As a result, so 73% of safety incidents, so we are not alone. All the world over, when you look at safety incidents, 73% involve environmental factors. So 3/4 of them is because of environmental factors. So that's something to keep in mind. So what is the solution? So the idea we are putting forth today is everyone should be a safety inspector. So the traditional model is we have a safety team or internal auditor team, maybe 4 to 6 people go around doing the safety rounds, versus just imagine that every department every day is looking at these safety aspects. So let's say we have about 400 staff. So that many, inspectors are at work every day, not once in a week. So that is 67 times more coverage. So this becomes a proactive continuous model more than a reactive model. So things, now you go and keep searching for problems in the facility rounds. Instead of that, every day these sort of people have this lens towards facility, so that these facility rounds now are turned into more like an audit than actually facility rounds. So you have to shift the culture from blame to shared responsibility. So that's what we're suggesting. So how do we do it? So how do you develop the superpower of seeing what others miss? So this is something which people ask me. Why is that you're only seeing these things? I've gone past this place so many times. You have this critical mind. Actually, in a way, it is a bit of a frustration, but also it is more of a strength. So let's take this example. Usually, we talk about this the banana peel on the pavement. Who's going to pick up? So we brought this example of banana peel inside the hospital corridor. So you have this banana peel, which is a slippery thing in the corridor, in a busy hospital corridor. So that happens at 7 a.m. And what happens? 7:15, there is a nurse walking across and thinks I'm late for round, someone else will get it. There are so many, housekeeping people there, they will probably clean it up. So she doesn't pick it up. And a doctor walked past saying, who's come for see a patient from some other department. And he says, oh, it's not my department, not my responsibility. Anyway, the environmental services are there to look after it. And the other odd boy who's pulling an empty stretcher says, he's already seen it, at 7 o'clock. Again, he's coming back at 9 and saying, my God, I can't believe that nobody has cleared this mess. Okay, so this is the usual story which goes on. And what we want to stress is the person who prevents harm is you, not someone else, not the safety officer, not someone more senior, not somebody who's will come later, but it is me. The moment I see a hazard, I make sure I clear it up, or at least stay there to make sure that it is cleared up. So we all should take this role of a safety guardian, because not only the patient safety, even our staff safety depends on this. Next slide. So how do you activate it? So now you could, first I'll tell you a very basic way. You have to see it first. So this is the most difficult part. So you got to train your eyes to scan continuously as you keep walking, from ceiling to floor, to see if there's any hazard which might be dangerous to the staff and patient. And if you see it, you take the responsibility. And if it is easily possible to fix it yourself, just do that. So if it just takes 30 seconds or 1 minute, you can do it. But if it is going to be something complex, then you need to flag it, make sure you follow it up, and make sure it is done. So to flag it, you got to tell others, inform your team or supervisor, whoever is, can solve that problem. And very important to have a register. Every department should have a facility inspection register, where whenever they come across some problem like this, it is entered so that we can learn from these problems. So these actions will not take more than 2 to 3 minutes, but will prevent, so much of hours of suffering and harm. So your superpower, I told it is a superpower. It's nothing. It's not a superpower. It's like Kung Fu Panda, talking about the secret ingredient. There is no secret ingredient here. No, it is just, your awareness and the courage to act while others are walking past. So that is something which, if you develop, that is the superpower. So once you start doing it, you set an example. The other, especially the seniors here. So it will create a ripple effect. If I, as a consultant, I'm wearing this tie and all those things, I stoop down and pick the banana peel and throw it in the bin, others are watching. And that you're creating being a role model. And once you start doing it, then others will start following it. So that is how we can, save costs and save, a lot of suffering for the patient or the staff. And we can put our time usefully into other things. So we have to create this culture where each person owns the safety in the environment where they are working. So that is very, very important, to remember that we need to set an example, be a role model for that. Next slide. So let's look at another real world scenarios, a couple of them. So here is a typical example where at 2:15, the ICU fire alarm activates. Electrical equipment malfunction, and staff attempt to evacuate the patients on the same floor, but find that the emergency exit is blocked by all these monitors. And the fire extinguisher has expired. So it takes almost double the time for the evacuation to move all the equipment out of the way and to get a proper fire extinguisher to put out the fire. So you can imagine what this delay can cause in terms of lives. So a simple discipline of not putting the monitors in front of the emergency exit could have avoided this. Next slide. So just a minute and I'll go back. I think this is a very important. The Navy SEALs, I know many of you will know that Navy SEALs are the US force. They are the rapid action force. Whenever some terrorist attack happens or whenever they want to do, they are called the Navy SEALs. Even in India, we have those people. So in an emergency, you will not rise to the occasion. You will default to the level of your training. I think it's very, very, good to think about it. So only in movies we have this hero coming and doing all these things. But in real life, in emergency, you will default to your level of training. So how much your training has been and how much you are able to think through at that moment is what will make the difference. Next slide. So the solution is converting the knowledge to muscle memory. Unless you keep doing these drills, unless you sort of start thinking about looking at your facility or environment on a daily basis, things are not going to change. So you need to scan daily. You need to assess. Somebody has to go around and do a weekly assessment so that the fire doors are tested and immediately flag if there's anything is not there. And every week, the team can have a 5-minute shift huddle done every day for emergency preparedness. So this is something which has to build into the day-to-day workforce. Next slide. So let's look at another example. Here is a power failure. So at 3:45 p.m., there is a power outage, power cut, we say here, which affects the surgical wing. And the emergency generator fails to activate because the battery backup for life support is also running out at the same time. Two things. The generator is not starting. The batteries are not being charged. So these are all things which can be easily prevented by doing a trial run of the generator on a daily basis and also making sure the battery checklist has been instituted for all the critical equipment. So you understand that it's not just some facility I'm talking about, it's also equipment maintenance and so many other things are included in this, or what we call as the care of the environment. Next slide, please. So, of course, we need to do the generator inspection, monthly function test, quarterly, battery backup test, and critical equipment registry. These are the answers, and we need to put these systems in place. Next slide. So now we talked about it, and everybody's saying, yeah, I think it's a good idea to do the daily facility rounds within the departments. But how do you actually implement it, and how do you make it work? So that is what we're going to discuss in the second part of this webinar. So before we start, I thought we will clarify what we mean by environment of care. So environment of care means everything around you that affects the patient's safety. So it is the place, it can also mean the environment where care is given, but here it has a different meaning, that environment of care is around in this area. What are the things which can actually affect the care? So it could be physical hazards like wet floors, broken equipment. It could be safety systems like fire exits, alarms, oxygen supply. It could be infection risks, and it could be security issues. So if it can harm a patient or staff, it's a sort of environment of care issue. So that particular hazard will affect the environment where care is given. So what we do right now, it is not the old way, it's the present way. We form a facility rounds team. We have a safety officer, and the maintenance head, the biomedical engineer, the nursing, and maybe the quality team. All of us go around the hospital every week nowadays and do a facility rounds and create a report of hazards form. And it is then submitted to the administration for corrective action. So many times you will find that the solution or the corrective action or preventive action for that particular facility rounds keeps on lengthening. It kept pending, and it will be like 2 or 3 months. The same issue is being flagged in every facility rounds. So this, if it is not clear, then definitely it is going to lead to harm. So this is what we do currently. Next slide. So what we need to do is every staff member in every department becomes a safety. We don't want to call a safety officer. Again, they'll get a bit threatened. So we're saying safety sensor. So, or sentinel, whatever we want to call it. So there's no waiting for the facility rounds. And there is no gap between the two facility rounds. And each of us start looking at our own department. So as I told you, the facility rounds will get involved in an audit just to see how each department is doing their daily facility rounds. Next slide. So for that, this is the framework you can follow. As I told you, it is very easy to say, yeah, do it. But how do we do it? Is what I know we're going to describe in the next few slides. So we can put it in an acronym called DART. DART means it goes very fast. So our facility rounds is like rapid and happens every day. So that is why we chose this acronym. So D stands for detect. Detect the hazard. Train your eyes to see hazards continuously. A is to act. Fix it as soon as possible. If it is not possible, you tell it to somebody. You flag it and tell it to someone who can solve that problem. R is report. So document whatever you have reported so that it can be followed up and it can be used for learning. And T is tracking. Close the loop, make sure the hazard is eliminated. So this is an individual responsibility and we need to do it. So this change won't happen overnight, and we need to take some time to put this culture in place. So phase 1, you do sensitization. Maybe you show this webinar video and tell them all about how we can do it on a daily basis. And phase 2 is activation. So then you start practicing that every day in the department. Keep asking every day, just before the handing over or whenever you have the team together, did you practice? Did you find anything? And phase 3, we have to sustain it to make sure it becomes a habit. So sensitization, activation, each department takes care. It's no longer waiting for the 5S team to do all these things. We do it ourselves. And then sustaining, there are always 2 things. You need to recognize the people who actually report in front of everybody. so that you show that these people are recognized, and repeated training. Now you have to keep on repeating this training again and again so that people start doing this and becomes a daily habit. So let's look at this DART framework more in detail. So how do I train my eyes to see others? So this is known as the 360 scan habit. Every time you enter the space, you have this mindset. It's not that you're always thinking about it. It's in the back of your mind. Is there anything in the space which could be harmful to anybody? So look for tripping hazards, equipment issues, infection risks, security gaps. So when you start, you may think, oh, I'm not good at it. But anything, when you read about habit forming, anything which you do continuously for 21 days will become a habit. And it will become more and more number of days you do it, it becomes more of a, it's just inbuilt into you. So you can see here in this particular picture, there are 4 hazards which are circled. Okay, one is the ceiling, false roof being loose. This is very common. Suddenly you will know on the patient rooms as false ceiling will fall down, and then an incident report is raised. Only after it happens. So why can't we detect it? It would have been there for the last so many months, but nobody bothered to report it. Similarly, a wire in the ground, wet flow, and so many things are pointed out here, which usually we'll miss unless we have this mental model there. So step 2 is act. So it is known as the 30-second rule. You need to fix it if you can. If not, you get somebody to fix it, but don't walk away. Okay, so anything which can be done within a minute, you do it just now. If you cannot fix it, at least put a marking. See, for this example in the second picture where the doctor is putting that X, the oxygen line is very close to an electrical outlet. How many times actually do we see this? And if you go today and look around, there will be many places in which the oxygen line will be very close to the electrical outlet. And this is a potential cause for fire. So if you sort of put a sign, each of us can have some sort of sticker where it can be flagged and you report it. And you got to tell the proper people to come and solve this. So it's very, very important that you do not wait, assume that someone else will do it. You yourself flag it, and the staff should be empowered to do it and sort of praised if they do that. So the third thing in DART is report. So first is detect, second is act, and the third is report. Even if you have done and sort of solved the problem, you'll still report it, because as you keep reporting only, you can look at the data and learn certain things like patterns and who's accountable. And also you'll be able to recognize people who have reported most. And if someone gets hurt later, documentation shows due diligence. Even after that, some problem can happen. You can't totally eliminate these things. But then if somebody puts a consumer protection court case against you, you could show this register. This is what we're doing on a daily basis. In spite of this has happened. So that will be in your favor. So keep this simple and don't make it too lengthy so that people hesitate to report. So just a quick entry and then it is submitted and done with. So the final word is the T, which is track. So close the loop. So it is not enough just to report and forget about it. So each of us have to take the responsibility and see, whether it has been fixed. And we could nominate a departmental champion to review all the open items on a weekly basis. If not, escalate to the, facility safety officer. And the supervisors also can have a part, and in turns, you could get these things discussed in the safety committee meeting and sort of praise the departments which are doing well on a regular basis so that it becomes, something inspiring for other people to follow. So that's the DART framework: detect, act, react, and track. So what motivates? Okay. So it's not something which you can force people to do. Now, change will not happen if you put rules. So this all happens when you build in a culture of people reporting this, and when people report, you give them some reward. So keep clicking, So it's quick wins. So, and leadership support, recognize them and have this ownership in the unit. It's very, very important. So this is how you motivate people rather than force them to do it. So when you do this, then the transformation happens. So from the facility rounds, which happens periodically, which is more like you're hunting for facility defects. So the facility rounds happens where we go to each ward and each ward tells you, okay, the last week we had, this many issues and these are the things we have solved and these are the things which you are planning to solve in the coming weeks. So it becomes more conversation on what are the things which has been escalated to the safety team is done there. So the ownership is shifted from the safety department to the each individual department. Of course, there will be barriers. No change cannot happen without barriers. So there'll be time people will say, I don't have the time. We already are so busy and adding one more responsibility. So you need to make some cases, histories about how just spending those few minutes every day made a difference in other units and other wards. And some people are resistant. So there you can share the success stories and start it as a small pilot with people who are not resistant. Always there will be a group of people where some people are resistant, some people are more forthcoming. So take those people, work with them, show them what results can happen, and then slowly the other people will join the bandwagon. So sometimes there will be resources, not finished, resources barrier. So start small, don't be very ambitious, and be patient, and also make them accountable. Make more by positive reinforcement than negative reinforcement. Don't say you're not doing it. Praise the departments which are doing it so that you said make them set an example. So this whole thing is a part of what is known as the just culture. So just culture comes as short for justice culture, meaning that when errors happen, you don't react and punish that person. You step back and ask yourself whether this is a system problem or an individual problem. So that's what happens in the court, isn't it? The court doesn't give a punishment immediately to anybody who comes, who's made a crime. They look at both sides of the coin, take the time, and then only pass the judgment. Likewise, when errors happen, we are too quick to blame. So we need to change that. So that is why it is known as a just culture principle. So systems or majority cause the errors, not the individuals. So it makes the individuals in the system make those errors. So that's a very subtle culture shift which will go a long way. And whenever somebody reports, there should not be any direct sort of action against them, because once you start punish somebody because they made the errors, others are watching you. So once that happens, then people will not report at all. Your incident reporting will come down. So when reporting comes, you tell them that this is a systems issue. I understand that you made a mistake, and also look at what individually they can do to avoid that mistake. It's not that totally saying that you're not responsible. Yes, suppose somebody gave the wrong dose. You should have double checked. So the double checking is your responsibility. So that is something which you have to do. But if the documentation systems and the process systems also need to be changed, it has to take precedence. But if somebody is making the mistake again and again, they are habitual offenders. So you need to deal with them differently. You can't excuse everybody. So if it happens for the first time, yes, you can counsel them. You can say, yes, I know you are feeling bad about it. Second time, you can train them. But it keeps happening again and again. So you need to actually take punitive action. So just culture is not letting people go off the hook. It is being stratified in reacting. So some people you will counsel, some people you will coach, and some people you will take severe action, depending upon what their behavior is towards errors. So then you have to learn from near misses, go back, So, so these are known as good catches. Don't call them near misses. It has got a negative connotation. So you tell them it is a good catch. So this error, nobody noticed. Nobody till I've been working here for the last 5 years. I never noticed this electrical socket was near the oxygen thing, and you noticed it. So it is a good catch, and you learn from that. You celebrate those incidents, and as I told you in the beginning, you need, as a leader, if you are leading a team, you need to be the role model. So you have to do those 360-degree scan, start reporting more often, correcting things in your department. Then the ripple effect will start, and people will start changing. Next slide. So if we do this, imagine the hospital 6 months from now. So if using this DART framework, if every department starts doing this, staff automatically scan for hazards. Hazards are resolved within hours. Incident rate drops not because it's not reported, but they are caught early. And facility rounds is just auditing, where they go to every department and probably give them stars for such good work. And the staff feel empowered. They feel part of the quality journey, and they take pride in that. They'll make this place safer every day. I read in this, I read a book last week, and I really liked this particular incident which happened when in the 60s, when NASA was trying to put man on the moon. They had not yet, Apollo 11 had not yet happened. The man had not set foot on the moon, but they were all working towards that. So a press reporter went to cover this what they're doing in the mission control, it is called, in NASA. And he, in between, he wanted to go for a bathroom break, and it was very late in the night, about 12 midnight. And he went to their restroom, and he saw one cleaner cleaning the bathroom at that time of the night. So he was very curious and said, "What are you doing at this time of the night? I mean, nobody's is not there in the toilet. What are you doing here?" The man looked at this press reporter and said, "I am putting the man on the moon." So imagine the culture they developed for this achievement. How did they do this superhuman effort of putting a man on the moon? That's because they drilled it into every individual, even the person who cleans the toilet, that they're all working towards this common goal of putting the man on the moon. It was such an inspiring story to read, and I wanted to share with you. So if you do this in your department in a small way, they all will feel empowered that I will make this place safer every day. So it is not something which, a theoretical webinar. I hope it is not. If we do it on a daily basis, this can happen in each and every hospital in our country. Next slide, please. So let us take this sort of thing to our hospitals, where you use this simple framework, train our staff in every department to detect, act, and follow up and track these things so that they are solved rather than waiting for the facility rounds to take place. Next slide. So the choice is ours, right? So we discuss about this. I don't know whether I'll be able to change this in my hospital. Now I'm being very frank, okay? Because the culture is so difficult to change. So do we continue the facility rounds the old way? Go every month and look at defects which nobody else has noticed, put it in a spreadsheet, keep following it up, and then go on and on. And the staff are just sitting there thinking, facility rounds, one team will come and do it. It's not our responsibility. My job is to give injections, and the doctor will think my job is to see patients. They're not bothered about the environment and what defects there are. So this is what is happening today. But this is my suggestion. So if we do it, can we change it? By the simple framework where we train our staff, we have a small system working in each department where these defects are looked at on a daily basis, reviewed on a weekly basis, and escalated to the facility rounds more like a report rather than an inspection. We do our self-audit, and when the safety team comes in on facility rounds, we tell this is what we have achieved, this is what is pending, we need your help on this. So that will totally change the way the facility rounds happen. So as we started, the banana peel is waiting. Who will pick it up? Every day, no, every one of you see these hazards. Are we going to take this as our responsibility, or are we going to shift it to the safety team? So that's the question. So with that, we'll end here. And if there's any questions, we will discuss that. Before that, Diana, before the questions, you can just tell them about the handout we made.
Yeah. So a brief, introduction about our handouts. I think a lot of you have been benefited by these handouts, and I urge all of you who especially want to implement these in your hospitals to look at purchasing them. It's all for 99 rupees. We have got a very resourceful handout, and it's got end-to-end implementation toolkit. It's got evidence-based and globally aligned practices, and it's also scalable, engaging, and sustainable. It's got templates that you can use for your hospital, and it also has a checklist that you can look at. So it's a very useful thing, especially if you want to implement it for your hospital. So you can all purchase it using the link that is given in your chat box. I think our admin manager will post the Razorpay link on the chat box, and anyone who pays for it will receive the link or the PDF for the handout. So all of you can make use of this opportunity to purchase the handout. And also we've got the ICN course. It's a special course for all nurses, especially those who have 3+ years of experience. We've got a distinguished faculty list, and the course is designed to benefit every nurse to upgrade your career and skills. If you have been planning to take a step towards better patient outcomes and better designation and pay in this new year, now is the time for you to upskill. The course is at an offer. It's usually 7,999, but today, the past 1 month, I think we've been giving it for 11,999, and a lot of you have purchased the course. So until stocks last, I think all of you can, purchase it and make use of this course. And you can register.
Can you share the link for the handout in the chat box?
Yes, I think our admin manager Jayanti will be sharing the link for the handout. Yeah, and the key takeaways from this very useful webinar, we've learned about the DART framework. We've learned about the environment of care. So this is a reminder for every staff member and every clinician to make safety a habit. And remember that culture change needs leadership support and closed loop feedback. So I urge all of you to implement this in your hospitals and give us feedback on how it went. And also, all of you who have questions, please post your questions in the chat box. And we also have some upcoming sessions, very interesting sessions coming up. So you can explore all the sessions using our event calendar. So it's posted in all the social media forums as well as WhatsApp. So you can, register for any course or webinar that you're interested in, and you can continue on this journey of learning with us. As you can see, we've got webinars every Friday, and we have got IPC free webinar. This is for infection control. This is for all healthcare professionals who are interested in infection control. And we also have a master class starting this month. So this is antimicrobial stewardship program. You can stay tuned to our social media channels and WhatsApp for more updates on this. It's starting on Tuesday, the 20th, and we've got a lot of exciting things coming up for you. This is for those who are new here. I think a lot of you might already know how the certificate. Yeah, a lot of you might already be know. Dr. Pari, I think you're not on mute. Yeah, so I think a lot of you might already be aware of how the certificates reach your inbox. For those who are not aware, we have automated the entire system. So tomorrow by this time, if you check your email inbox, you would receive an email asking for you to, fill up a Google form for our feedback. And once you fill the Google form, within a couple of minutes, you should see our certificate in your inbox. So if you don't see it in your inbox, you can check your junk email. And then if you still haven't seen it, you can reach out to our admin manager. So we've got time for some questions. This is our WhatsApp community QR code. So if you are interested in joining our WhatsApp group or our community to look at more updates and interesting offers and insights, you can scan the QR code and send us a request to join the group. And also we've got a QR code for the ICN course. Offer is running. So any of you who are interested in the infection control nurse course, you can register here. As well as the handouts. I think you all would have received the handouts QR in your chat in a couple of minutes. So you can either scan it or use the Razorpay link and pay for it and get your handouts. Moving on, if you've got any questions, please do post them in the so the handout link is up on the chat. And there's someone who's asked who all can do the ICN course, Dr. Neetika Trivedi. Dr. Pari, do you want to give them a brief on the
Yeah, this
ICN
is
course and the
actually
new course that's coming up? Yeah.
the ICN course is for nurses, graduate nurses, registered nurses who have more than 5 years experience. But we are rolling out the infection control and prevention course by third week. Is it done? Or it's last week?
Yeah, we should be done by the third or fourth week.
Yeah. So by end of this month, we are releasing that infection control and prevention. That is open for everybody. So we'll get back to you on that. But this ICN course is for nurses, registered nurses who are more than 5 years experience.
There's someone who's asked for the presentation. I think no worries on the presentation. You can all look at our YouTube video. It should be up in a couple of minutes after this webinar is closed, and the live is already running. You can download the video if you need it. And if you have any other questions, please do ask. So I think that's about it. Any questions, you can put it on our chat box or in the questions.
Doesn't look like any questions are
Yeah,
there.
no questions, I think, today. Thank you so much for your participation. We look forward to welcoming you for our next session. Thanks.
Thank you so much. See you next week. Bye.
So those who have paid for the handouts, you can just get your handouts from the admin in WhatsApp or via email. So if you can wait for a couple of minutes after the session, you will receive it. So everyone who's paid through the Razorpay link will be receiving your handouts very soon. And for the WhatsApp, you can scan the QR code which is shown on the system. If you're using your phones, you can take a screenshot of this and scan it a little later. If you've got any difficulties, please let us know. We will be able to help you. So once you have finished scanning for the WhatsApp link, you have finished purchasing the handout, and you've attended the webinar, you're satisfied, you can leave the channel so that we'll know who all are waiting to finish a couple of things or need help. So once you're done, you can sign off. Thank you to everyone who said it's a very interesting session and given good comments for us. Thank you very much. Make sure that you're following us on all our social media handles, Instagram, Facebook, and WhatsApp community channel, so that you have our updates and also some insights into educational material as well. Thank you very much for joining us. Thank you for everyone, all the healthcare professionals interested in our infection control course. Like Dr. Pari said, I think initially the course was meant for nurses, but we are doing a course for other healthcare professionals as well, like doctors, clinicians, microbiologists, anyone else who's interested in infection control. So you can stay tuned to our channels for more information. By the end of this month, we should be rolling it out. We've got a lot of people in our waiting list, so you can make use of the course as well. A lot of people are asking how to collect the certificate. I think two people. I'm not sure whether you were there for the session, but if you were there, we just mentioned how our certificates have been automated, and we'll be sending you emails by tomorrow. That is, in 24 hours, you'll receive a email with a feedback form link. Once you fill the feedback form, in a couple of minutes, you should receive the certificate in your email. We have automated the entire system, so anyone who's attended the webinar will automatically receive the certificate link. If you've paid for the handouts, you do not need to send the screenshots. We will take an account of all those who have paid, and in the next half an hour to 1 hour, you should receive your handouts via email or WhatsApp. So we have your numbers, we have your email IDs. We should be reaching out to you with the PDF. Thank you so much. So I hope all of you have taken down our admin's number. So in case of any difficulties, you can reach out to our admin manager, and you can join our WhatsApp group, so that we've got more than 1,500 people in our WhatsApp groups. So we have created multiple groups to accommodate all of you. So you can join the WhatsApp groups and make use of all the announcements, and also any queries you have, you can use the WhatsApp group. Thank you so much. Yes, we do have an ICN course for nurses, and the QR code is on the system. Albany, I think we have put the course QR on the system here on the slide. So you can scan the QR code and register immediately. For more information, you can contact our admin manager. She'll put her number in the WhatsApp, in the Zoom chat. So if you need any assistance and any more information about the course, you can visit our website or call our admin manager, and she'll be able to help you. If you've got all the information that you need and you just want to register, then the QR code is on the slide. You can just scan it, or you can take a screenshot of it and scan it later. Thank you so much. If you've got all that you need, if all your queries are sorted out, you can log off. You will get your handouts. You don't have to stay on the line. You will get your handouts if you've paid. If you don't see any handout in the next 1 hour, you can contact our admin manager again. I'll put her number in the chat so that everyone can see. So our admin number is on the chat. So if anyone of you have questions, reach out to our admin manager. If you have scanned the QR codes, if you have resolved all your queries, if you've done everything that you need to do, you can sign off, and then we will close the session. Thank you very much. We'll be posting the link for our handouts, the Razorpay link for our handouts on the WhatsApp groups as well. So if you have missed paying for it, if you have missed, receiving it now, we will be also sending it through your WhatsApp groups. So you still have an opportunity to, collect it after this.